Welcome to Let's Talk About Health, powered by Focus on Diabetes. Focus on Diabetes partners with accredited doctors to share education and new treatment options, world class healthcare organizations to introduce new technologies and free screenings for diabetic patients, their family, and the community. Now, let's talk about health.
Hello, everyone. I am Tiffy, and today on Let's Talk About Health, we have Maren Lenhart. She is a Community Impact Analyst for Delta Dental of Iowa Foundation. Maren's role includes analytic review and reporting on data for the foundation's oral health and overall health goals. Prior to joining the foundation, Maren was an oral health consultant and project coordinator for Iowans for Oral Health, a statewide community water fluoridation coalition led by the Iowa Public Health Association. She was also a dental assistant. Did I get that right?
You did. Yep.
She has her master's in public health from the Des Moines University and her bachelor's from Iowa State University. So, welcome, Maren.
Thank you, Tiffy. I appreciate the opportunity.
Oh, awesome. So, I gave a brief description. Why don't you tell us a little bit more about yourself?
Yeah, well, I'm a dental nerd by trade, but I know we have partnered Cedar Valley Focus on Diabetes and my employer, Delta Dental of Iowa Foundation. We have connected on oral health and diabetes related efforts, knowing that those two are interrelated. I have always been passionate about public health, and now I'm in a position of being able to support that throughout the state of Iowa. We help fund and partner with organizations like your own who are actually doing the good work. So we try to recognize and lift up your good work and see you every fall at the screening event too.
Awesome. And that event, everybody, Focus on Diabetes is the first Saturday in September. So don't quite know the date yet, 100% for 2025, but we'll let you know that. So Maren.
Yes.
First question. Fluoride.
Yeah.
That's what I'll ask a few questions about. So there's a lot in the news about taking fluoride out of the water. What are your thoughts on that?
Yeah. Well, that bleeds into my previous role. So I think fluoride is actually a natural substance. It's a mineral that's found in all of our water supplies at some amount. And fluoridation, like community water fluoridation, really is about adjusting that level up or down to an amount that helps protect teeth against dental decay. So we say cavities, dental disease. A lot of people don't realize that decay and cavities are actually dental disease, and it's probably one of the most common childhood diseases outside of asthma. So my feelings on that, I can say personally, and knowing that Delta Dental as a company, we support optimally fluoridated water, that helps provide an oral health benefit for all who consume. And so that spans geographic disparities, and just anybody who consumes it, so that will have benefit to that. Not everybody has the opportunity to visit a dentist or can afford that, but they still can receive a little bit of that benefit by drinking the water. It has been in the news quite a bit. I think one of the other things that has been noted is there are stop points in place to say, hey, if the water has too much in it, meaning an excessive amount, that there are stop gaps in place to notify residents and also to ask to remove it. I think there's one area in Iowa that has a very high amount, and they take steps to reduce it. Otherwise, most sit within that recommended amount by the CDC.
So also with that being included, I go to the dentist just about every 6 months. Sometimes a little longer, sometimes a little longer.
That's all right. You can be honest. I won't shame you.
Because every time I do go, they do offer the fluoride treatments.
Mm-hmm.
Is that a good idea? Because I don't drink a lot of tap water. I do drink a lot of bottled water, though.
Hey, you're not alone. I would say, excuse me, I think that's a conversation to have with your dentist, because I would say it depends. So you can do what's called a risk assessment of have you had a filling or cavity in the last year? That puts you at greater risk. Do you already have, so if somebody's on chemo or if you have diabetes, that can put you at greater risk for dry mouth and cavities. So then a fluoride treatment would be a great option for that. I think we have some cavity prone years when we're kiddos, when we're young kids. It's not just kids who eat a bunch of sugar. I think that's a common misnomer where, okay, if I just quit drinking or would just quit eating my Snickers bar, I'd be fine. But even things like goldfish crackers and saltine crackers, they sit, no shame, you can eat them. I eat them too. But they sit and break down into simple sugars. And then that mixed with the bacteria and the environment in our mouth, that's what can cause that decay. The fluoride helps protect against that. So I think of that as putting like a clear nail polish barrier on. Is it perfect? No. Does it help? Yes. And so if you're at high risk, you can get, so if somebody's on chemo, you can have multiple treatments. Sometimes your dental benefit plan can allow that as well.
If you have dry mouth related medications, what can you do?
I'm going to always say, since I'm not a dentist, to make sure you check with your oral health professional. That can be your hygienist or your dentist. One thing that we would recommend in our office is to, a lot of times people want to suck on candy. There's sugar-free options, or there's over-the-counter products that are saliva substitutes. I don't know if I'm supposed to name brands or anything. This is just what we would do for our patients would be called Biotene.
Oh, okay.
They help keep the mouth lubricated. When it's dry, that's when it can wreak havoc. So that's very common. Blood pressure medicines, chemotherapy, dry mouth is very, very common, and it's treatable.
Didn't know that blood pressure medications can affect that too.
They can.
So how often should we visit our dentist?
Ideally, because I'm not going to shame anybody, ideally twice a year. If you are high risk, or because we're talking about it's Diabetes Awareness Month, if you or somebody who's listening has diabetes, you're at a higher risk of having gum inflammation and gum disease in general. Not all, but some. And when that happens, then typically the recommendation is up to 4 times a year to get cleanings in between and help stay ahead of that. The reason for going to get a cleaning, because you might say, why can't I just brush my teeth? Isn't that good enough? That's a great start. Our mouth also has tartar on it. So that's the piece, think of them like little minerals or rocks that attach to our teeth that brushing alone won't remove. And so that's what the professional cleaning's for. If we don't do that and we let that build up over time, it pushes in between our teeth and our gums and causes inflammation. And I know I've heard on some of your other presentations on here just about inflammation and how that can impact A1C levels and diabetes, but chronic inflammation in our mouth also impacts our overall health. So 2 times a year for, I would say, typical. If you feel like you're healthy, if you've been told that you have gum disease or might need a special type of deep cleaning, then that can sometimes be up to 4 times a year.
Okay. If you're kind of like shut in and can't get out, what would you suggest for someone to do if they can't get out to the dentist?
Yeah, so we're working. That is actually part of my day job of trying to work with partners who are solutioning this. The easiest thing right now is to try to reduce sugar-sweetened beverages. So drinking water would be the best. Brushing with your teeth, brushing with your toothbrush. And then if you aren't able to get to the dentist, and this depends, there's several nursing facilities throughout Iowa that might have a dental hygienist who comes to them. We have this amazing program in Iowa called iSmile. It's managed by Iowa HHS, and each area has a local dental hygienist who can go in and provide screenings. Sometimes they can do cleanings. They can come to you. That's an option, maybe not one by one, but definitely happens in nursing facilities. The other part that's up and coming, that's pretty interesting. It's called teledentistry. It's been around on the West Coast for a while, but is happening here in Southeast Iowa currently, where you can take pictures, x-rays in your mouth. You can send those off to a doctor. They can help look and kind of triage or say, hey, Tiffy, it looks like maybe you need to be seeing a dentist like now versus let's hang on for a little bit. And when you're able to get up and out of the house, let's say it's a snowstorm or something, then you can find your dentist. So
that's nice.
Yeah.
I think that would be great. That is a good, hopefully they can get that up and going, because I think that would be awesome.
Yeah, there's lots of different ways that looks, and they can partner with, up in Cedar Valley, I know it's People's Community Health Center. Just lots of good connection.
Okay. What about foods to make your teeth stronger or healthier?
That's a good one. So apple a day keeps the doctor away.
Is that true?
I think it is true. Cheeses. So cheese has good dairy in it. Anything that I always think of, like apples and cheese, can help kind of clean your teeth. Cheese. You can even have chocolate. Think of like a plain chocolate bar, because that chocolate dissolves and moves off of your teeth relatively quickly. The things that sometimes get you in trouble would be the sticky, chewy, gummy type candies, the caramel type candies. Not that they're bad, it's just have them, brush your teeth, and then be done. When those high carb or the high sticky sugars sit on your teeth and get stuck, that's when they can become more problematic. So I don't like to say, nobody can have this. I don't think there's a dentist who would say you can't ever eat this. But it's more about, making pretty good choices most of the time. The other part of that is
okay?
What?
Ice cream should be okay.
You can have ice cream once in a while too. I was going to say sugar sweetened beverages. One thing that, we read a lot and I hear a lot too about getting I have my water in here, but having like a big gulp drink and sipping sugar sweetened beverages all day long. Think of that as constantly bathing your teeth in acid and sugar. And that's not super great long term. Can you do it one day? Can you do it a week? Absolutely.
Which beverages? Which beverages primarily?
Well, I don't want to throw anybody under the bus. Anything that has full sugar, that can even be orange juice, apple juice. So things that we think are healthy, a lot of times people would put those into baby bottles. But it's that constant bathing where it becomes problematic. I don't think there's any pop that's necessarily bad.
Okay.
So I like Dr. Pepper. You can have Dr. Pepper, drink it, and then be done and move to water. It's when you're able to sip on it all day long, that's where it can be problematic.
Okay. What is this? I gargle with peroxide 1 to 2 times a day, in addition to brushing with toothpaste to help with bacteria teeth whitener. Is that too much?
So I'm going to go back to I would ask your dental provider, because I am not a clinician. I'm a dental assistant by trade, but I'm not a dentist.
You guys do a lot of the work though.
Hygienists do. I hang out with the dentist. I would say it depends. Absolutely, peroxide can whiten surface staining on the teeth. That's actually what bleach and bleach trays are often made of. Some people have some sensitivity with peroxide. So when you ask if it's too much, and I say it depends, I think that's a question to ask your dentist, and just to kind of see how your overall mouth is doing. How are your gums? Are they nice and healthy? How are your teeth? Are they feeling sensitive? But yes, that is something I see and hear many do.
Okay. What are you as far as dental, how does that affect a person's overall health? Let's say you're not going to the dentist quite as often, and somebody's like, I'm feeling a certain type of way. Some people don't think that having dental problems or problems with your teeth can actually cause as many health problems as some people might think, like, oh, it's nothing.
Absolutely. I think that's the one thing about dental disease and cavities and inflammation in your mouth, it often doesn't hurt or you don't notice it until it's too late. So if you aren't able to go to the dentist for a variety of reasons, there could be barriers, finances, trying to get there. If you aren't able to, your eyes and your mouth are kind of two windows to your overall health. So through vision exams and through dental exams, you can see inflammation. Sometimes people can make a very educated guess of, hey, you might have diabetes. Like, have you checked your blood sugar? Think of, I know in I say diabetes world, you talk a lot about chronic inflammation and A1C levels. So a mouth that's not healthy, meaning it hasn't had the tartar cleaned off, the gums aren't healthy. Not only is there inflammation in your mouth, that might be red, puffy gums. Sometimes you can smell an odor or taste it. But that inflammation also goes through your system, your body, and impacts your overall health at all. I think if you have diabetes, you are at an increased risk of having gum disease already, which means an additional risk of inflammation. When that happens, and I know Bridget's talked about this too in the past, that can make it harder to manage the glucose and that A1C level. If you don't have diabetes, it's still impacting through inflammation, which we know is not great for our body at chronic levels.
Right.
So that's something, those are great things to talk to your primary care provider, also your dentist or your dental hygienist. It's important to share that information with them so that they can provide you the best care. And if you need additional appointments to keep those gums nice and healthy, that's a possibility too. The other place you see it is when people are pregnant, and sometimes puffy gums that bleed and hurt. That's inflammation too. It's called gestational gingivitis, where you get puffy gums, and that can usually go away, but it's something that you want to be able to share with your doctor and talk about. It is inflammation in your body.
Oh, I would have never thought about that. They don't really talk a whole lot about, dental and when you're pregnant.
No, but you know what? There's a great partner in our state called Healthy Birthday and the Count the Kicks app. So when somebody is pregnant, it's a stillborn prevention app, but there's also some oral health questions and messaging in there saying, hey, pregnant person, have you been to the dentist? The health of your mouth directly impacts the health of that unborn baby. Yeah. And so I think Iowa Black Doula Collective does a great job with their doula services of talking about oral health in pregnant people. And then that Count the Kicks app that's free and can be in various languages. That's another great place. We're pretty fortunate in Iowa to have both of those partners and resources.
Well, that's nice.
Yeah.
So any students, if there are students, teenage students that are looking into getting into dental assistant, dental hygienist, what advice would you give them?
Oh, okay. If anybody wants to get into that area, please reach out. And if it's not me, I will connect you with somebody in your area because it's amazing. I would say, I just got all excited. You'd ask me what advice would I give?
Yeah.
Or what? Well,
things they should maybe be looking into, like colleges,
yeah.
If there are classes that they can take either in high school or things that they can get done prior to kind of like get them going.
Absolutely. I would say anything in health, math, or science. And saying that can scare people in the same breath. So I will say there's lots of different ways. We do have a dental workforce shortage in Iowa, just like many other professions and healthcare professions especially. There's multiple ways. So dental assisting is the person that's helping the dentist day in, day out. They are sitting there. Every single day is different. So if you like to work with your hands, if you want to still be able to provide patient care and connect with your patient, dental assisting, you can do on-the-job training in Iowa and then sit for some exams. You can also go to Hawkeye would be the closest one to you, a community college for a program that's just a little over a year, I believe. That can come right after high school or a GED. You can shadow if you want to ask your dentist, or if there's a dentist to say, hey, could I come watch for a day? That's great too. If you're wanting to maybe explore dentistry or dental hygiene as a career, dental hygiene requires a 2-year degree, and that can be at a community college. We have several in the state of Iowa. The one that's nearest Cedar Valley is, of course, Hawkeye. They have a brand new, beautiful, beautiful building that I am fortunate the foundation was able to partner with them, but they have both programs. And I believe all of the community colleges have something called last dollar scholar. So if finances feel like that's a barrier and it feels really overwhelming, if you're trying to take care of your family and work and go to school, because it is hard. There are opportunities that help support those dollars and other scholarship type programs. So assisting would be the first step in, right out of the gates. Hygiene, there's typically a waiting period, a 2 to 3 year wait right now. And so you can do some of your science and math classes ahead of time in anatomy and physiology. And then dental school, those are typically, we have one dental school in Iowa at University of Iowa. And those individuals typically have a science-based background. But what I would encourage people to do is find student clubs or community health centers where you could either job shadow, possibly volunteer, or just ask and learn.
Okay, that's great. So, so focus on diabetes 2025, September 2025. And I know you have been. If you want to just give us a little bit of information on your experiences there, will you be there this year? Because we do have some high school students that we have, they volunteer, they come in also. And if you'll be there next year, being able to connect with them if they have questions, giving them a little bit more information. So let us know about all that fun stuff.
Yes, absolutely. I know my colleague with the dental wellness plan. So I am on the foundation, but the insurance side has the dental wellness plan. They have that on their list. When I went up in the past, I would love to talk to anybody who's interested in dental as a career. I also know your strongest partner that shows up is Hawkeye Community College. They were there right outside the dental screenings, if memory serves. I think there's a new program director, but either one of us, we can help connect, and would love to talk about dental. I think if you're a caring person and you enjoy healthcare and you don't mind working with your hands, you get your steps in every day. It's just a really rewarding career. The other nice thing, I know poor Bridget and her nursing. Nurses are amazing. My mother's one. But like dental world has some pretty nice hours. You're not usually getting called at 2:00 in the morning on a weekend. So
which is
great hour.
It
is amazing. It's a good career. It's a great income, good benefits, and just it's sometimes overlooked, I think, because when we're in school, we're not thinking dental. People think medical, nursing,
right?
And like vision, dental kind of gets pushed to the side. So.
I agree.
But yes, I am planning to be there in September. One of my favorite things is the way you have that set up. You have your screenings for all of your podiatry and foot care, dental screenings, your vision. And then the other part that I love, you have those vendors where you can learn and ask questions and get information, or just how to sign up for benefits if that's something that you need. But the other thing that I think sets you apart from just a traditional health fair type atmosphere is how you connect with your app at the beginning when you're taking in information, and how you have the educational sessions. If memory serves, you had one that was in English and in Spanish and last year, and just different health information. I think that's great. You're meeting the community where they're at. And it's pretty impressive to see. I know that those are welcome, but very laborious events to put on. So kudos to you and the team.
It's so much fun.
It is fun. You're all wearing your green shirts. It's all really positive. I think sometimes healthcare can be scary, especially like what you said, if you've been shut in or you haven't gone out, people might be resistant or even embarrassed to come and like say, hey, it's been a while.
Yeah.
The event that you have absolutely breaks down all of those barriers where nobody is shaming. It really is, hey, life happens, and if you need to get back on track, we're here with you. And I do applaud you and Focus on Diabetes, the entire team, because it's something you do really well.
Oh, thank you. So programs like Focus on Diabetes, why do you think they're important to the communities and the people coming in, or just people being able to watch Let's Talk About Health? Why are different programs like our program Focus on Diabetes are important?
I love your program for many reasons. One, it is very local. So I am based out of Des Moines, and I am a passionate oral health enthusiast, but I have a feeling people don't necessarily care what Maren says. It means more when it's Tiffy, when it's Bridget, when it's Terrence, when it's the people that you see at the grocery store and interact with every day. You're local, you're connected within that community. The other portion is that you absolutely have representation that matches Waterloo, Cedar Valley area. Mm-hmm. And I think that matters, especially from a just systemic and historical racism and not having providers who may look like us. So it's important to have a variety of healthcare professionals that are trusted. And I can say anything down here in Des Moines and encourage you, but when it's Tiffy and you're talking to Tiffy's friend's mom that you saw from the school in Waterloo, it does mean something. And you're knowledgeable too, right? This is your passion and you want to help.
Right.
I think those things are very important when it's a grassroots coalition that's local. There's lots of great work going on in the Cedar Valley area. And I think you are very focused on making sure that it's accessible to all. You've also done that with a language, like adding Spanish and helping individuals who may not speak English as their first language to still share information as well. So,
well, we hope to add a couple of more languages. There's a big French speaking community here too. So, and like Haitian Creole and Swahili. And then there's a big Marshallese Burmese population too. So, but yeah. But Maren, also, if anybody wants to be able to get any information, if you just want to let them know like where they can reach out to, or they need to look up any sites or anything. So
absolutely. I think I saw that the email just went on there. So if you have any questions or you want to be connected with a dentist or hygienist, or if you need help finding one who accepts your insurance, or it's been a while and maybe you want to go back, you can reach out to me at that email address below. The flip side too is if you're working with a nonprofit, so Cedar Valley Focus on Diabetes is an example of that. And you want to, say, do an educational presentation, maybe in the schools. This could be as a student or wherever you're working. The River Arc, I know you were saying French speaking, they're a great nonprofit that's in your area. If there's something you're sitting here going, wow, you know what, I didn't realize there was this connection and that it really is so significant. There's a lot of research and data behind it that supports that. I would love to share this information with my community, but I don't know how to make that happen. I would be happy to, one, help find resources that work best for you. If there's some funding that would help support that, let's have that conversation. The other part is even just supplies. So toothbrush, toothpaste, and floss. I don't ever assume that we all have access to that, because I know that we don't all have access to that. So the only thing we ask in return is that there's a little bit of an education component, and I am more than happy to help connect you with some of those resources that have been developed. PBS Kids has a great one. But if you're in a school and want to work with a school nurse, PE teacher, and talking about drinking water instead of sugar sweetened beverages, how do you make your water fun? Those are all like cucumbers and mint. Maybe that's not kid friendly, but strawberry water is delicious.
I'm working on it. I used to do so good with water intake, and now I'm like,
You know what? You don't have to be perfect though, Tiffy. Even if it's like one or two that you've switched out, right? I have my water. I also have my coffee this morning. And I already admitted that I like Dr. Pepper. So
Well,
you don't have to.
I think Dr. Pepper's not bad.
Anything with lots of sugar. It isn't bad when you can do it in moderation. If that was the only thing I was drinking, then that would be different. But it's not, I'm not going to bash the pop companies because it's great. I drink it too. I think it's how do we make those small shifts, and sometimes getting out of that all or nothing thinking of, okay, I'm only healthy if I do X, Y, and Z.
Right.
If you swap out and have a glass of water tonight before bed and you're thinking about, hey, maybe my glucose has been off the wall and it might be something to do with my dental. Okay. That next step is, okay, where do I go? How do I get time off? Where do I go? There's lots of different resources to help with that. But we have a whole team of people that would love to help connect you. And we'll do it in a way that's kind and not shaming anybody if it has been a while.
Okay, that's perfect. So again, Maren, thank you so much.
Tiffy. It's so nice to see you again.
I know, well, you'll see me again. Like, hopefully you'll come.
I'll see you in September for sure.
And
you've got your green shirt on.
Oh, I got no blue scrubs today.
I have one too. Oh, I do. I have a gray one. I have a gray Focus on Diabetes shirt with the big magnifying glass in the back.
Oh, see, I was like, we need to get some more fun ones.
You can do it.
I think so. But yeah.
Well, hey, dream big. If there's something you want to do for oral health this year, I know you're great. You have the ASAP clinic that comes and does dental screenings. Hawkeye's there. If there's something like a drinking water station or some way to make that fun and incorporate that and it fits with your vibe, let's chat.
That is a good idea because a lot of people don't drink, they drink water, but not a whole lot. And it's like, I just don't like the taste of water, which there's really no taste. And they're like, well, we can add the little squirters or the little sugar packets. And I'm like, some of those are too sweet and they just don't taste right.
I keep wondering, are we just all walking around with these water bottle Stanleys just for looks? We should put water in them.
It is for looks.
Right, just put my Kleenex. No,
yeah,
you can fill them up with water, though. It really does. All joking aside, it does impact your oral health in a positive way and your overall health. So,
see, somebody's like,
it's just not.
You know what? Maybe this year we can get the teens together, and maybe they can do like a workstation when it comes to like water, how to increase water intake, make it taste a certain type of way. It's a good idea.
There is something you can Google, like water infusion recipes, and your life hack is to get frozen fruit because it's a little more affordable. And we've done that at work. We called it Water Wednesdays. So it feels really overwhelming to do it every single day. What about one day a week? Water Wednesday. Just make a small switch. Just like I saw, was it last month's video with Bridget, hopping around and moving your body and jumping on the rocks. So move your body, drink a glass of water. We're good. Check your A1C.
I'm working on moving my body. 2025, January 2025.
You know what? Every day is another chance to just start new. Doesn't have to be perfect. So everybody tells us, right?
That's what they say. So just remember, is it brush 3 times a day or at least twice a day?
At least twice a day. I would say figure out a time that it feels right for you. That can be morning and night. Sometimes we didn't even talk about flossing.
And I was just about to be like, floss, floss, floss. I'm not a great flosser, but I mean, I do my best.
So that is wonderful. You can flossing, think of this like your teeth like this. If you are brushing, you're not getting in between, and the flossing just helps in between. A lot of times cavities like to form in between and then they impact 2 teeth. If flossing is not your thing and you like to toothpick, I know that's a lot of people will use a toothpick or even like a water pick. There are other ways. It's really trying to not be aggressive and just remove some of that plaque so it doesn't harden. And it really is bacteria and the bacteria leaving deposits behind.
Yeah. So I was like, I'm going to floss more. I'm going to try.
It doesn't have to be perfect. You got to find like a floss that you like. I think that's one of the keys. Sometimes floss rips. There's kinds that are fluffy. There's kinds that are
I
different.
don't think I've seen the fluffy floss.
There's some good fluffy floss. There's ones for like when you have braces, but they have little, even, you know what, even those floss picks, if that helps people, I use those too. So it's what works best for you. And if it's coupling your toothbrushing, there's some people that would come into the office and say, hey, I brush when I'm in the shower. I don't know how, but that's a lot of people. And you can brush. Go ahead in the shower. Just get it done.
Oh, wow. I would have never even thought about doing that. Like,
I would be really curious with some of the individuals that you work with who are monitoring their A1C levels with their provider, their healthcare provider, if they know that maybe this has been a struggle spot in the past and they want to just commit for the next 4 to 6 weeks, like, hey, I'm going to try to do this. I would be really curious to see how is that impacting that. It's not always a perfect science, but it's a step in a good positive direction, and just having a healthier overall you.
oh yeah, I agree. So any specific to, since it is diabetes awareness month, specific dental information for people with diabetes and our diabetics out there?
Yes, I would say the first thing is, if you please try to brush twice a day, and tell your healthcare provider, that could be primary healthcare, that could be dentist, make sure that they know that you have diabetes. Depending on, so I'm not on the insurance side, but if you have insurance, sometimes your plan and your benefits will allow for additional cleanings if you have diabetes. That's and that's not extra cost to you. That's good to know. So you can have your mouth cleaned and have nice, healthy gums and teeth. The other thing is just to remember that if you have diabetes, type 1 or type 2, that gum disease and inflammation, if you aren't able to keep it clean, it absolutely does get into your bloodstream and can impact your overall health. You're not the only one at risk. That can be happening just to me as well, and I don't have type 2 diabetes. But just knowing that if you're not feeling great and you've been going to the doctor, but something just feels off and your number, you can't get that number under control, because I think that happens. I mean, we've had conversations about that, and I hear stories about that. Maybe it's worth having a conversation, go, hey, have I not had my teeth cleaned? Could this possibly be a step towards improving that number and just improving your overall health?
Right, okay.
And then stay encouraged. Doesn't have to be perfect. Flossing, brushing. There's electric toothbrushes that are out there that can sometimes be helpful. It's finding what works for you, and it doesn't have to be.
Are the electrics a good idea though? Maybe?
Love electrics. Yeah, they're great. I would say the only sometimes people are very aggressive brushers. This helps reduce that, so that you just guide it. You don't brush and buzz along. You guide it. You guide it. That doesn't always meet everybody's price point. You do still want to switch out your toothbrush head periodically, especially if you've been sick. But there's lots of different ways to help keep that mouth nice and clean.
So when you said that, especially with being sick, I know for sure if you ever have strep, you need to switch out your toothbrush.
That's the nurse in you. That's a nurse.
Yes. Cold, do you have to switch it out too, or just...
I would. That cold sores, typically it's once a quarter or every 3 months or after you've been sick. So COVID going around. Yeah, you just can't see those germs. It's not that much different than other germs, but it's,
yeah.
And also the other thing, I shouldn't assume, not sharing toothbrushes. There are situations I've heard where people, maybe one family is sharing a toothbrush. If that happens, I would love to know if there's some folks in the area that we could find a local community partner and get some different supplies. I do realize sometimes a toothbrush is still $3 or $4. Fluoridated toothpaste is $3 or $4, and that's the difference between, a prescription or food on the table. So if that is something that is a barrier and somebody feels comfortable either reaching out to you, or to us, I would be happy to connect them with somebody local, or even send some supplies, or connect people's community health is
That's a
great.
good idea, because like, even you know how like some of the kiddies, they'll come in, oh, we'll give you a sticker. How about we give you a toothbrush?
You know what?
Or a little
Sticker and a toothbrush. Tiffy, can we do both? Sticker and a toothbrush?
Yeah, you can do sticker, toothbrush, and of course your sucker. So can I get some candy?
Well, and if you're seeing kiddos and they haven't been to a dentist, or they have a hard time getting in, you've got a great eye smile coordinator, that dental hygienist who's like a community health navigator. They are very well connected to help navigate that piece. And you can say, hey, I need you to help so-and-so. And then they're absolutely there to help with the care coordination. And it's all about, kids miss school because they have dental issues and pain, and we don't always know why. They have behavioral issues. It might be because they can't see the board to read, or it might be because they have decay that we don't physically see yet, and it's bothering them.
So with that, can that cause different infections and other things?
Absolutely. And that's probably the saddest part and most important reason why you want to catch things early. We've been talking a lot about inflammation in the body, and an infection in your mouth can absolutely go into your bloodstream. And probably the most, unfortunately, I don't want to say famous, but unfortunate case is an individual named Diamante Driver. He was a child who died because of an infection that started in his mouth. Went to his brain. His parents had a difficult time finding a dentist that would accept their insurance. This is over in Maryland. He was an awesome kid who didn't want to, I think there were multiple children, and he didn't want to make a big stink, but his mouth was hurting, didn't say anything. And then it got to be too late, and he ended up dying. I wish that was the only time I'd heard a story about that, but I hear stories similar to that, even in the state of Iowa, all too often. So that is part of the reason in my day job with Delta Dental's Foundation is looking for those kind of systemic solutions of how can we be talking about this more, either connecting it in with a primary care visit, or just using my teammates on the other side to help find a dentist if somebody is having a hard time finding access to a dental home. Lots of good stuff going on in the schools too with kiddos. I think you have folks coming in to do screenings, fluoride varnish. That goes all the way back to fluoridation, and why it's so important that if you have these other barriers, that drinking the water can offer that protective benefit.
Oh, well, now we might have to start drinking a little bit of tap water.
We'll put a little like strawberry in it, cucumber water, mint, pineapple. Do pineapple?
I've never tried pineapple water.
Okay, I'm gonna send you a whole bunch of recipes.
See, you know what? I might need some of those. I think I do, because it's always lemon water, lime water.
It is lemon and lime water.
So I'm like,
what do you like, Tiffy? Like, what's your thing? I don't know about chocolate water.
Because I used to could drink a ton of water, like at least 64 ounces, and now it's like I can't.
That's okay.
I can maybe get 32 ounces in a day.
You know what? That's better than nothing.
Right. So again, Maren, awesome. Also, focus on diabetes. We do have some dental toothbrushes available. Please reach out. I think there's a focus on diabetes email if anybody wants to throw that down there. If anyone needs access or any toothbrushes, we have plenty, I do believe. So
if somebody needs help finding a dentist or a dental appointment too.
Yeah.
Or if you don't know if you have an insurance benefit, or you're having problems finding an office that accepts it, we have a whole team that is their passion is to help get you connected.
Yep. So those two emails that you guys saw, the one on focus on diabetes, and Maren, I'm going to read yours here. IA, is that a dash?
It's an underscore.
IA underscore.
Foundation, I know.
Foundation at deltadentalia.com.
Yes.
Maren, if you want to give us the final thoughts, great information, definitely. And I think they just dropped those emails. So kind of take those down for information.
Well, I want to say thank you for one, realizing, and no, you guys have known for many years because we've been in connection for several years, of the importance of oral health and diabetes. That link, it's important for both sides. I know this is National Diabetes Awareness Month. Thank you for inviting me to have a nice, fun conversation. I know we covered lots of different topics. That could be finding a dentist. Why does it matter? Workforce, if somebody's interested in, hey, you know what? I just saw Bridget had posted an article about her own dad and how hitting his foot was really caused a lot of issues that impacted literally his life. I don't want that to be somebody in their mouth and their condition because their mouth had an infection in it. Individuals with diabetes are at higher risk. But that doesn't mean it can't be managed and managed well. And there's a whole team of oral health professionals that really want to help and are passionate about making that happen. So as you continue on your journey with diabetes awareness and getting A1C checks and having those conversations with their medical provider, thank you for also remembering mouth and eyeballs, both of those.
Yeah. The one thing my mom did tell me was to take care of my teeth. And I'm like, definitely going to take care of those because I want to keep mine.
I want to keep mine. I want to keep mine too.
I got 3 removed.
People are keeping their teeth longer than ever before. So you'll see things about trying to go after World War II and people were not able to go because they had dental infections or they didn't have enough teeth that connected. But that's for another time.
All right. Well, thanks everyone. And Maren, thank you for coming on and giving us all this great information on dental.
I'm happy to be here, happy to be a resource or connect. And then if you happen to represent another nonprofit organization such as Tiffy's that she is representing tonight, I would be happy to chat with you if that's something you want to bring to your community or make connections if that's helpful. Thank you. I appreciate it. Tiffy, I look forward to seeing your whole team next year. I'll probably see you before then.
I'm going to tell my son, you know what? I think that is something you can work on, putting a presentation together this year for Focus on Diabetes when it comes to water.
It's fun. It's fun. I like your idea. Who could come up with the best flavoring?
I agree.
Yep. Thank you.
Thank you, everybody. Oh, we're back.